I know most of us will be off now, or for weekend, especially some of us that are doing 8 to 5 jobs. You might be off over the weekend. How are you today? This is your friend Nurse Solution. We've been doing some series on health now for some time, and the the how do I put the feedback had been so good. So that's why even when I don't feel like I should just I have to keep going and keep moving. Likewise yourself, whatever you're going through, there are times you feel like a depressive day, a day you don't feel like going. You still have to keep moving anyway. Just keep moving, keep going, keep going. There is no time. There is no. So tonight, without much ado, wasting our times, we want to talk about men's health tips. There are various ways you could live your life that could make you to remain healthy, that is preventing various diseases and complications. And if you're having certain issues, there are ways you can live your life that could, of course, prevent various conditions that you're going through from being further complicated. So that's why some people say health is wealth. And for me, as a nurse, I believe in preventive health. Preventive health is far way cheaper, less time consuming, less bigger peace, bigger space, bigger time to do other things rather than being sick and the whole family, the finances keep, going towards one place. The stress is on the family, a lot of things. So you just have to do believe in preventive health rather than curative. Curative is more expensive, more time consuming, more resources consuming. And at times when somebody is sick, especially maybe the husband or the father is sick in the family, you begin to see things like uh, the effect on the children, whereas it's the father or the mother that is sick. So, assuming the father is a breadwinner and is on sick bed, he couldn't work, he cannot provide, you see what that means to the family, or even is the mother. So, preventive health is the baseline, is the fine detail, the nitty gritty of health. So, when we're talking about prevention is better than cure, in other words, we are saying when you prevent, you save money, you save resources, you save time, you save further complication, and of course, you save death, untimely death about this case. So, tonight, and if you look at women go through stress, but men are more stressful, they go through more stressful things. For example, if a woman has issues, maybe you have had a breakup or something, it's likely for you to cry, shed tears, and as soon as whatever you're going through as a woman and you shed tears or you are crying or something, you feel better, and there are a lot of tensions being relieved of your body. But men, even somebody serve them breakfast, being their nature, they tend to keep things at heart. They don't want to communicate. I experienced a case about 6 or 7 months or thereabout. The wife was, I will not even say was, the wife is an abuser, violent, beats the man up. But because of what will society say, what will society say, the man kept, coping, coping, coping until he landed in the hospital and he started bleeding. And of course, when you get to the hospital, you don't have to lie to your doctor, to your nurse, to your lawyer. You understand? Just tell them the truth so that they will know how to help you. So he was forced to open up to the doctor and said that since 8 years of marriage, the woman has been physically abusive. and he has not spoken to anybody, not even in his own family, for 8 years. But majority of women, if they put 50 women, about 40% of us, though we would like to cover our spouses because we don't want people to know, because but like 70% of 100 of a woman would have spoken out that, oh, I'm going through, is it physical abuse, is it mental abuse, is it this and that in my marriage. And when you speak out, 50% of your problems are gone. But when you decide to keep mute, you keep getting repressive and you get into depression someday soon. So that's why men go through a lot of stress. Women go through stress, but men too go through a lot of stress. The bills, the emotional stability on them, the financial stability, the security, the protection. We want everything from our men. And even when they are not able to, they are still trying to cover up so that you, as the woman or the children, will not feel bad. So let's just, how can you as a man live healthily? How can you live healthily? How can you prevent further complicating the health conditions that you're going through? Or how can you know, prevent yourself from like having like heart diseases, diabetes, metabolic disorders, like cancers, like depression, like hypertension, which is a silent killer. Most men are nursing hypertension silently. Most women too are nursing it. So, as a man, how do you want to maintain a healthy life? Number one thing you want to do is get moving. Exercises is very, very important. And when we're talking about exercises, you don't need to go to gym, because somebody, I was discussing with somebody some time ago, and he said, I don't have money for gym. I know you might not have money for gym. Gym is not all about exercises. Gym is not all about exercises. Exercise is not all about gym, and gym is not all about exercises. Right. Now, you want to exercise, you can make it just in your in your building, in the house that you live in, because of course your house will have a frontage, and if it has a frontage, of course there should be something like the back, like in my country we call it backyard. You understand, the back of your building. Now, the back of your building, you want to do an exercise, you don't want to go to the gym, or you cannot afford it or something, you can make the frontage of your house the point number one. You want to do exercises because according to WHO and the health experts, they said we should, both women and men, we should do a minimum of 30 minutes of exercises per day. You understand? So that's about 180 every week. Now, if you are not able to do this, okay, if you're not able to do 180, maybe you could do the best, like 3 days a week, let's say Monday, Wednesday, or Friday, or thereabout. That's about 90 minutes of exercises instead of, well, 180. You understand? It's better than nothing. You understand? Now you want to say, okay, I want to run around this building like 20 times. Then you go, when you come back, you read, that's, you finished one, going around the circles. You come back, make the frontage, or a landmark, should be a landmark that you will use. Then the second time you go round, around, and again you come back, you have gone two. By the time you've done 20, 15 to 20, you see that there's sweat, bits of sweat start coming out from your body. And so you don't need the gym or something. You understand? If you could afford it, why not? You could just jog within your area. Jogging within the area is something that somebody could do if you don't have money for gym. You could go swimming. We call them cardio exercises. I'm talking about cardio exercises. They are heart friendly. You understand? They are friendly. There'll be, adequate blood flow to the heart. There'll be adequate oxygenation to the lungs, all parts of the body. If I sit down, like in the hospital, when some people are sick, most of our patients that comes and they are going to be staying like 2-3 weeks in the hospital, there is a particular drug we give to them. We call them, those group of drug, anticoagulant. Because when you stay longer on the bed, you're not moving, your blood tends to clot. So when they clot, if there is no anticoagulant, clotting tablet to be given to your injections, what happens is that along the line, your blood start clotting, and it can one day just hang in the brain or hang within your lungs. And that was what we call thromboembolism. Thromboembolism. And when we're talking about thromboembolism, it's one of the things that kills. You must have heard, oh, that was thromboembolism. That was thromboembolism. You understand? So when we are sitting down, we are not active, our blood might not be able to flow as it were. And when our blood is not flowing as it were, it can be clotted, and somebody can come down with thromboembolism. And if somebody like the kind of country I live in, God help you. If you go down with thromboembolism, you might not live to tell the stories, because it kills us in fast. To just block the lung, block the just that's it, because that's the clotted blood. So when patients are not there, we give them anticoagulant to make sure their blood keeps moving. So when an expert is not telling us, when the experts are not telling us, it is better to do exercises. And one of the reasons is for blood flow. The blood will flow. There is no how you keep moving. It is different from just sitting down and doing nothing. Some of us will say, the type of job I do, I used to walk around like as a nurse. You usually stand to nurse before documenting on the system. So I can be doing my wound dressing. I can do wound dressing for like 7-8 patients at the same time. If I start from one bed to the other, 7 patients, minimum of 5, 7, 8 like that. Before I wrap the dressing, before I dress, before I remove the previous dressing, I might have spent like 30 minutes on each patient, a minimum of 20 to 25 minutes. Now calculate, let's say minimum of 20 minutes. By the time I'm standing with 5 patients, 20 minutes, that's well over, that's about 1.5 hours standing. God helping me, if it's like a Monday that is so busy, or a Wednesday or a Friday, I might stand more than that. So imagine, like somebody like me is now justifying that, the type of job I do, I used to stand, the stress. No, exercise has to be intentional. It has to be intentional. That's why you see some people that might not be able to control themselves by doing exercises. You see them get to the gym and say, oh, let me go and do it at gym. When I see people, I'll be able to get motivated to get moving. That's why you see some people at the gym. Then apart from that, it is very essential for you as a man to sleep adequately. Adequate sleep is very, very necessary. And when we're talking about sleep, some book of thought said it is 8 hours minimum every night. Some say it's supposed to be 9 hours, some say 10 hours. But let's just make the borderline at 8 hours. If the borderline is at 8 hours, it means as a man, you're going to work the following morning, you must be able to sleep maybe 9 p.m. so that you wake up very early in the following morning. But how many of us, as at that 9 o'clock, maybe you are still inside traffic trying to get home, or you are still at work trying to leave or something. You understand? So it is not always easy for us to catch up with the 8 hours. But it is recommended that you sleep minimum of 8 hours a night. Apart from that, when we're talking about mental health, we cannot do without mentioning healthy diet. And when we're talking about diet, we have healthy diet. That means we have unhealthy diet. And we have various classes of food, from vitamins, from minerals, plant oil, protein, carbohydrate, and of course, we have water. And this water that we're talking about was not even part of the initial plan, but it was recently added that water is a group of is a group of classes of food. They added it to the classes of food. So when we're talking about healthy diet, a balanced diet means when you eat all the classes of food, your protein, your fat, your carbohydrate, your minerals, your vitamins, and your water in adequate proportions. Not that, oh, I don't really like fat like that. It's only carbohydrate that I like. You eat it in the morning, eat it in the night, eat it in the afternoon. Oh, I don't really like that. I prefer protein. You eat it in the morning, eat it in the night, eat it like that. So it shouldn't be like that. It should be in adequate proportion. For example, if you're going to have to take like 10, let's say, eat in the morning, you're going to have like a normal day, you should be able to eat, maybe you want to take like 2,500 kilocalories of food per day, for example. In the morning, you should be able to incorporate what we call the breakfast. You can have small breakfast. In the afternoon, you can have your heavy meal, especially the kind of staple diet we have here. Most of them are carbohydrates in nature. Then in the night, especially if you are 35 and above, you understand? There is law of diminishing return. When we are growing, it's like we are growing, and you see a 20-year-old boy look so energetic and athletic. Give them another 20 years, you start seeing them doing the start the declination of strength. Their strength begin to get abated, their eyes begin to get dim, and you begin to wonder, "Ah, but I was strong." By the time you are 60, oh, all the bones, most of the, even as of that time, most men must have started having what we call low testosterone, which is the male sex hormone, the major male sex hormone. So a lot of things happen when you don't eat healthy. It can lead to heart diseases like hypertension. It can lead to what we call atherosclerosis, that is excess fat deposition in the walls, the lumens of the heart. It can lead to arteriosclerosis, where there will be hardening of the muscles of the heart. And instead of the heart to contract, one, two, the heart starts doing slowly. And the some, because the blood cannot flow through it as it's supposed to flow, go just like that, and be contracting and relaxing. And what is the essence? It can lead to what we call slump and die. And you hear people driving and their heart could not cope, they die. And you hear people maybe doing exercises or jumping or at the gym, you just hear them slump and die. You see some people, even in the house, they slump and die. So most of those slump and die that you hear is they are mainly issues with the heart. But in this part of the world, you hear people say it is try is a family arrow, it's a spiritual arrow. Yeah, they say it's spiritual arrow. But whereas the heart has been, giving signs and symptoms that I'm getting tired, I'm weak, you are climbing, you are getting tired, you are walking up maybe to the second or the third house, and you are sweating, you are not comfortable, you are breathing with difficulty. The heart is saying something. It's not all the time that it's long, or it's because I have malaria typhoid, because in this part of the world we like self-medication, especially because the way the government has made our health is not working, especially if you are below average in this Nigeria. I think your health is in the hand of yourself and God. Oh. You understand? So because there is nothing like insurance, even as a government service, as soon as you are there, they are removing your money every month. When something happens now, you go, they say, this one no cover, this one no cover, this one no cover, nothing wey dey cover, nothing. And when they want to give you drugs, they will make sure they give you the inferior drug that you can even get home and go and die, or go and have a side effect that can kill you. So most of the time, I don't even bother myself to go there. I just go straight and take care of myself and my family, right? Because I'm a nurse. What if somebody is not a nurse? I bought some drugs last year. I had a diabetic drug for someone, and the sugar kept going up. After about some few days, something just told me, "Abi, this drug is fake." Me. And I bought those drugs, just one sachet for 5,500, because I was trying to save money. So I now went to buy the one of 10,005, that another company, which is an imported drug. And that one too, they say na imported though. Immediately this person took it. The sugar was 300 plus. The sugar went down straight within 2 hours to 180. By the time he took the next one in the evening, the sugar was almost 120 or something. So assuming I was not enough, the person would have just died in the house. because of fake drugs. So your diet is very, very important. It helps your brain, it helps your heart, helps your skin, helps your blood, helps your bone, and it also helps your sexual health. We'll be getting to that. It helps your sexual health. So apart from that, how do you want to cope to maintain your health? Number one, you have to learn the rules and the rudiments of stress management. It's not possible that you not go through stress. Either even a baby, babies go through stress because people will come, oh, congratulations, they will not allow them to rest. As this one is touching the cheeks, oh, he resemble daddy, he resemble mommy, fat baby, thin baby, dark baby. Babies go through stress. And when they are stressed up, they cry. It's because they are stressed. If they are not stressed, you see them sitting and sleeping and be eating all the things that they have, provided. So you have to learn when you are stressed. When you, like me, when my body is telling me you cannot go, I will just say I cannot go. I will rest. I will rest because when you don't, like, when you miss some certain hours of sleep, like they said we should do 8 hours of night sleep, right? Assuming I'm not able to do that, maybe I'm sleeping around 11, and by 4:30 I have to go to work the following morning. It means I've done just like 4 to 5 hours of sleep that night. Tomorrow, which is another day, maybe I'm able to sleep 6 hours. I've, I'm indebted to about 3 hours of sleep. By the time I'm going through a week with 4 hours of sleep depth, yeah, tomorrow another depth, tomorrow another. Before you know, in a week, I must have had about 16 hours of sleep depth. So assuming I'm supposed to sleep throughout the hours for, let's say, 40 hours, and I'm able to do 24 hours, for example, maybe 5 hours here, 6 hours, it means have I have deficit of 16 hours this week. Next week, the same thing. Those things are still coming back. It will just look as if you are strong. When they come, you see people just get ill and some might not recover because the stress on the heart, especially the heart. That's why you see people driving. The heart is supposed to work 1, 2, and the heart is now working 1, 2, slowly, or it's not working because you are not resting it, overworking, and there's slump and that. It will shut down the way electricity shuts down, and that is it. So you have to know how to manage your stress. If it is financial stress, maybe you have a woman that is not supportive, you have to let her know that, guy, if I die, you will survive. Children, if I'm not alive, una go reach. So not that you are wicked, not that you are mean, let them know so that they'll be able to know how to call their code. Don't let your woman feel your maybe when they, most of men, because they want to retain a woman during courtship, they must have told her, I need 100,000, they will go and borrow. I need the iPhone 25, they will go and buy. Then you don't let this woman know the status of your purse. By the time the marriage is here or the relationship is advancing, you cannot log off. It's shocking because that's not your right, your real financial status. And the woman will keep since you can buy, you could afford the iPhone 25 when we were dating. Why not afford the iPhone 40 now? So it's better for you to let your woman, whoever you are dating, or even your wife, to know this is my financial status. No story. So we have to manage. This is how we got to manage. You understand? So you have to learn how to manage your financial status. If it's physical stress, if it's financial stress, you have to manage it. Your financial status has to be managed by you and the person you are dating. You understand? And if you're not married, if his family is down your neck, you still have to manage your financial status and manage your financial stress, so that one day you not just buy, because if somebody dies, they will just cry after the burial. Immediately they even see these people that used to do drum for them. Immediately they say, bang, 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 this person has gone. They start dancing. Immediately they bury somebody. So you still have your life to live. You have siblings, that they don't anything, there's no space for you. You have a parent, let them know. I don't know, I can no longer cope. I'm dying, I'm shocking. You understand? And of course, you have to prioritize your mental health. Your mental health, that's what we represent after our genetics, our DNA. The first thing you even want to manage is your mental health. And when we're talking about mental health, it's not mental illness. When you have mental illness, you have gone through, you have, there is a thin line between health and illness. You have moved from the health path to the illness part. That is mental wellness when that we call psychiatric problems. But when we're talking about mental health, whatever takes you from norm to abnormal is mental issues, mental wellness. So if, for example, you are owing someone and the person, and you have promised the person, today is Friday, you said, don't worry, by Sunday, I'll be paying that money, and you have said this is last week. And tomorrow, Sunday is just about 48 hours or thereabouts away from today, and you have not gotten that money. Anything that takes you into panic mode, and you remember, I'm supposed to pay this person on Sunday, and I've not even gotten this money, and this money is not small money. You are not, as at that time, you're not emotionally balanced. You're not emotionally balanced. If you are in a toxic relationship, a woman that comes, tear your dress, a woman that picks things, start breaking the glasses of your vehicle, the windscreen of your vehicle, a woman that comes, that tears your dress, beats you up, or you give a certain amount, she's always not satisfied. You have to stay away from toxic people. We are not saying marriage should break, but you cannot allow someone to push you into insanity. Insanity. Then you now leave the mental unwellness and goes to straight to mental illness, which is a psychiatric disorder. And you get to those places, the place they take care of psychiatric people, and you see them tied down because in the past they have killed people, who were staff, nurses, and doctors in the past. So they tie them down with chain. So it is not enough for you to say because you are staying in a marriage, there is room for your separation till everything cools off. You understand? You could separate. You could separate. Guard your heart, guard your strength with all your strength. Guard it against toxic environment, toxic people, things that are hot. If you're in any relationship that brings more of tears of anguish, sorrow, hurt, and pain, is that one a relationship? Think about it, though. Think about it. Don't go and cry inside that relationship. Guard your mental wellness, because if you break down, you might not be able to recover. So anybody that has psychiatric disorder, immediately has gotten to psychiatric disorder, they take drugs for the rest of their life. They will be, they will be relapsing. Even when some are on drugs, they are still relapsing. Some are on drug as in medication. You see them, they are still relapsing. They are still going through various challenges because the drug is, at times it might no longer work because of various chemicals in our body that the drug is supposed to act on, and there is contraindication, there is interaction and everything, and the thing go AY. So your mental health has to be well protected. Then of course you have to tell someone where you are going. Men, they have that habit, I'm coming, whereas they are going. In this part of the world, I'm coming. Coming, Bawu. No, where are you going? Okay, I would like to get to so place. I want to see so person. If it is possible, if you are not doing any corner love, you understand, you don't have any emotional infidelity, you don't have the physical infidelity, you could always well tell your wife that I want to go out. Tell people around you where your whereabouts. Let some, you cannot even tell your wife because it's side chick you want to go and meet. It's part of life. Nobody is judging anyone. Tell a friend, because at least I've seen men, married men, they are friends, maybe they are five, all of them has girlfriend, and the five of them knows each other's girlfriend. So tell your friend, alright, I want to go and see my girlfriend though, so person at so place. chicken, and nobody is coming to come. They are not coming there to come and join you for your enjoyment. Just let somebody know about your. It's one of your mental health tips. And of course, you should be ready for sex. It can be at any time. I no wonder some people you see them 24 hours, they are with their condoms. If you are over 18, you have at least partial license to have sex. So don't when you're talking about sex, you get ready for sex. Safe sex has to be paramount. You understand? Don't just put your dick in any dick Tom and Harry because you are high, because you are on. Mm-mm. Think about get ready for sex, but wisely. Wisely, your safety first. Your safety first. That place you are entering, do you know what is there? Maybe the person has a sexually transmitted infection that has been going around and she has not treated. You know, in men, when men has the sexually transmitted infection, the same route for urine, we call it urethra, in men, that sperm comes out from, is the same route that urine comes out from. And our urine is acidic. You understand? It's acidic. So when a man catches maybe gonorrhea today, you are infected with gonorrhea today, Friday, within by latest by Sunday, when you want to wee wee, you understand? Because that bacteria, that gonorrhea bacteria, is already inside your reproductive area. By the time it's Sunday morning and you want to pee, you will see the pain. It will be hot because your urine is acidic and is now coming in contact with the bacteria that's eating part of your urethra. So by Sunday morning, you will know that something has happened. But in women, we have different opening for urine and different opening for vagina as vagina. And most of the infection, sexually transmitted infection, will not get to our own urethra where urine will come out. It usually comes from the vagina. Some, even if it's urinary tract infection, can come from our own urethra, but usually sexually transmitted infection will come from the vagina. So and our uterus is so big. You understand? So somebody like a woman can have sexually transmitted infection today, and the symptom might not come in another 2 months, 3 months. And the thing will just be eating deep in that place. So, and that was the reason women don't usually know on time if they have gotten sexually transmitted infection, because the urine will not touch your vagina. It doesn't have any. In fact, they are different opposite. They are, miles apart. They are miles apart. That's just it. So you just have to practice safe sex. And if you are having lower erection, you cannot sustain an erection, or you are not having erection at all, it suggests maybe you have heart disease. So it's not all the times. Maybe you're having lower, you are having erectile dysfunction. There is no ability for erection, or you have it, you cannot sustain it, not even premature ejaculation now. It can be a sign of heart disease. So, or even something deeper happening within the heart. Because when there is an issue with the heart, the blood flow to the penis might not be, strong. And when it's not strong, you might not be able to sustain it. Without no blood flow to your penis, there cannot be erection. And when there is an erection, it means your blood is flowing, your testosterone is working. So you have to monitor the levels of your testosterone. And that's why if there is any issue with your sex life, especially is erectile dysfunction, after doing, one or two manual, it's better to see doctor. It might be a sign of a more serious issue. And of course, apart from that, you'll be able to monitor your prostate health. Within the male reproductive organ, we have a lot of organs. One of them is the prostate gland. And this prostate gland is one that produces fluids for your sperm to move. Ordinarily, when the sperm is being produced, it's just there, no action, it's just stick. You understand? No, it's not fluidish that it can move like that. Then the prostate comes in, secretes and produces its own fluid, And when it produces, is the one that we now mix together. Because when you are sperm, it's not only sperm, we have semen inside. We have the fluid that we're talking about. So we have a whole lot of things that, that makes up what we call sperm. Now, when it's now time for it to move, is the fluid of the prostate that we, you know, make it move. If not, the sperm will not be able to get to where it's supposed to get to. It will just die along the road because there is no movement. Because where the female egg is that they will need for fertilization to bring babies is still very far. So he has a lot of functions, a lot of dilly dallying to move before it gets there. So your prostate health, as soon as we are getting, men are getting older, there might be issues with prostate gland. For example, you have urinary, you tend to urinate more than the way, because that place could not, the bladder becomes weak. You cannot carry urine, maybe up to 600 mils inside your bladder, the way you were doing when you were smaller. You understand? When you were younger, rather. So now, with your prostate health, if you don't monitor it, you can start having blood in your urine. You start having urgency of urine before you get to the bathroom. You wee wee. You might cough, bearing down, and you see urine streaming down from your penis. You might see blood or sperm mixed with your. You might see blood in your sperm. You might see blood in your urine. You understand? It is better for you to go check out your prostate, because if they say 10 men, for example, like 7 to 8 might have issues with prostate. It might be prostate enlargement. It might be prostate cancer. You understand? And some that are even having infertility issues. It might be due to prostate not being able to produce fluid for the sperm to move for fertilization. So monitor your prostate health. Monitor your testosterone levels. Your testosterone is the one that is responsible for sex. We have various sex hormones, both in female and in males. So the sex hormone in men, the one that is called major, we have two of them. We have the testosterone, we have the androgens. So if with the androgens has its own function, but it's not as high as the testosterone. We call it a low testosterone. So if you have anything that is worrying you about maybe premature ejaculation, erectile dysfunction, or loss of libido, or low sex drive, or something, it is better to go and check your testosterone levels. You understand? So that doctor could do one or two things to still help you out. Because when you cannot satisfy your woman on bed, it can lead to relationship issues. It can lead to fertility issues. It can lead to low self-esteem. It can lead to depression. It can lead to depression. It can lead to breakup of relationship. Because what's the essence of a woman in the house? Months, day in, day out, year in, year out. You could not do anything, and the woman is just there thinking, oh, women start to feel as if you don't care. Whereas there are crises, So it's better for you to go and check your prostate, check your testosterone level, and make sure you are ready, always ready for safe sex. Because it's not all sex that are planned, especially if you're still single, you are not married. It's not all sex that you plan. As a married man, you want to plan with your wife. If you don't have a girlfriend, you have an appointment, okay, let's meet. You might be going and you are ready, you're prepared. But as a young guy, your hormones, we call it dopamine, the hormones of action, adrenaline, non-effort, is still flowing. You can decide to have sex all throughout the week. So be ready with your safe sex kits, your condoms, and all that. And I want you to know, if you have a woman that is using family planning control, and you say, you have family planning pills, I've taken it. It does not prevent against sexually transmitted infection. It will only prevent unintended pregnancy. So you make sure that any woman that you want to have short with outside, either you are married or single, you're still searching, use barrier methods like condoms, like dental dams, like female condom. We call female condom external condom. We call female condom internal condom, and we have dental dam. I've done a lecture on dental dam, so that you will not bring what is not yours, you not bring it up. And of course, if you are into excessive alcohol, you have to limit it, because apart from the fact that alcohol can kill your sex life, it does kill sex life. It can also kill your heart. It can also kill your kidneys. It can kill the liver. Those are the major. Apart from the effect on the skin, it has effect on the skin. It has effect on the blood. It has effect on your brain. Has effect on your liver, your kidney, and your heart. That is alcohol. You understand? So if you are into excessive alcohol, it is time either to quit or limit or moderate it. You understand? Maybe you can take like 5 bottles every day. You enjoy that. Why not one? Or maximally two. Make it two. Because we're talking about health. I work in the hospital. I see when they bring in people that they come and they say, I've been taking alcohol for 20 years, I've been taking alcohol for 30 years, and you see their health status, you are not happy for them. You understand? And of course, you have to know your family history. Your family history is very, very important. And when we're talking about family history, most of the times when people come into the hospital and you ask them, do you have cancer in your family? They say no, God forbid. Okay, is there any history of diabetes or hypertension? They say, God forbid, bad thing. There is nothing of such in their family. But I want you to know, neither of us, none of us can categorically say that this is not in my lineage. For example, if my aunt had breast cancer, my daddy's sister or my mommy's sister, they are my blood. It could be, it could happen to me tomorrow. You understand? Because we are genetically related. So the issue of I don't know, I know my grandma and I know what killed my grandma, the way she died. What killed her own mother? That's my grandma, my great grandmother. Then the great great, the great great great, the great 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 great. Do I know what kills them? No, I don't know. So that's the more reason I should be careful and don't just be blabbing that it's not in my family. God forbid bad thing. You don't know your family tree, especially in Nigeria. No history. All the history, the people are just, is gathering, gathering, gathering. They are not really factual. So if I don't know what will kill my great great grandmother, how will I know what killed the great great great? So if they say, is there any hypertension in my lineage? I might say yes or no, because I don't know whether those ones have, and we are genetically related. It might come down to me. Though my mother did not have, it might come down to me. Do you understand? So that is why you should know your family history as much as possible. Try, and know your family history. Then you need fresh air. All the time that you just stay inside AC and you are there, big man, you are in the morning, AC, in the night, AC, and you are sleeping all through the night, in the afternoon, you are just inside. You need fresh air. Your skin needs fresh air. And of course, you have to get into the sun. The early morning sun before 9 a.m., not 12 noon, maybe 1 a.m., 1 p.m. no sun is, we have uh we have vitamin D in our body, and they are just there, lying down, lying fallow. Nothing is there to synthesize them for my body, my bones to use. So if I get into the early morning sun, for example, the sun, as is acting, as is entering my body, is penetrating my body to synthesize the vitamin D in my bones to be able to work. Because naturally, the vitamin D is just dormant, not doing anything. And my bones need it. So the early morning sun, after all, might not be a bad idea. And of course, you have to stay updated on your vaccines. You understand? Like this hepatitis vaccine, you're supposed to take 3 shots. The tuberculosis vaccine, I think, is 3 too. The now we have malaria vaccines. We have whole lot of vaccines for women. We have the HPV. We have a whole lot of vaccines. So it is not enough for you to take the first dose and say you are not going for. Even the COVID vaccine is still much available, readily available in a lot of places in Nigeria. If you are, if you hear that there is any, don't say they want to kill us. Some people, especially in this part of the world, we are so ignorant. They say God forbid bad thing, and they want to use it to kill us. No, just go get yours. Be updated about the vaccine. Be updated on your vaccine. I know they might want to kill people because of some how do I put it, of different rumors we hear. But since I've taken COVID-19 now, how many years? 3, 4, 5 years ago. No, I never die. Oh. I never die. My daughter took HPV, human papilloma vaccine. That one is to prevent against cervical cancer, because cervical cancer is usually caused by sexually during sex. You understand? So it's usually caused. So and then I say, okay, let me give this girl this injection to prevent her, because if she don't get sex, if she doesn't have sex now, she's just a teenager. Very soon, you cannot hold them for long. How long will you hold them? These days, that 23, 24 are even getting married as soon as they finish school. Some of them will bring husband up. So is it not better for me to protect her? And if she's now exposed to anything, she might even say that I don't want to have sex until marriage, and somebody rapes her. Will I go and die because somebody raped her? No, because it can happen. Life happens. That's why I don't judge anybody. Life happens. And of course, you are a man. If your diet is not adequate, you can of course supplement with diet supplement. But if you have any issues, like you are having diabetes, hypertension, cancer, prostate issues, or any like ulcer, or any illness that you are currently on any medication, before you take anything, you have to contact your pharmacist or your doctor to be able to know, can I use this with this? Because there's something called drug interaction. You understand? It's like I'm taking malaria tablet and somebody now give me concussion or give me alcohol. Alcohol will interfere with the metabolism and the digestive processes and the job that malaria tablet is supposed to do. So is it not better I just take my concussion, jeje, or I take the malaria and finish it before I can? So when you drink it, you are killing your kidney and killing your liver. So concussion with your drugs is a no, no, no. It's a no, no, no. But in this part of the world, we too like concussion because we believe that's the way we were brought up, the way our grandfathers, our grandparents did, and they were living 150 years. But now things are changing. Those days, there's no pollution. In this area alone that I live, the number of pollution, the rate of pollution in this area, in fact, in another 10 years, if person still live here, who will live here stay. By the time you are going out of this place, your lungs is gone already. So we said, we don't dey prepare, say very soon. Make God just comot us for this area, we move. You understand? So it's one of the things that we should be careful. If you are taking supplement, I saw somebody last year, 2 years ago, 2023, that bought a supplement, 30,000 on Instagram pay, once on somebody Instagram pay, and she came down with kidney disease. She had about 6 dialysis before her kidney could pick up again. So of course you have to manage your weight. There is morbid obesity, there is mild, there is moderate, and there's severe obesity. So if you're obese, especially you have tummy, this is to the left side, just middle of my chest. So the underneath the left breast is where my heart is positioned. This place by the chest is my lungs. So some people will say, my lungs. No, my heart. This is not your heart. This is your lungs being covered by the rib bones. So the heart is just from here down underneath the left breast side. Now, if someone has heavy stomach, there will be pressure on the heart because the heart is here, and there will be pressure. There's something divides this under the breast and the stomach. We call it diaphragm, and diaphragm is one of the major muscles of respiration. As I'm breathing now, my diaphragm is in place. And if I'm not breathing heavily, my diaphragm is in place. So when somebody have big tummy, usually pressing on the diaphragm, which is the muscle of respiration, and the heart that is underneath here. And heart can become choked. There won't be space for the heart to expand and contract, to relax, contract, and relax. So it's one of the effects of obesity. The major effect is on the heart. Apart from the bones, if you are too obese, it can affect your joint, leading to probably you want to do a change of your knee joints. We call it arthroplasty. It can lead to that. And of course, don't just do over the counter drugs. You know, say somebody you are on a diabetic drug, or you are on any drug and you'll be using it, and somebody just say, you now complain to someone and say, my drug self, even my own, I've been using. It's giving me issue. And the person said, drop your own and come and be using the type of man. You just go straight to the chemist and go and buy. If it's like diabetes, like hypertensive, major disorders like that, it can lead to various damage, various complications, and lead to various complications. So don't just take and drop your own and I say, let me drop my own, I will just take my own. And of course, as a man, what do you want to do? Reduce your fatty food. In the fats that we eat, we have two main types. We have the saturated fat, we have the unsaturated fat. And when we're talking about saturated fat, saturated fat is like when you put your butter, your margarine, you put it inside ice block. It will just be there, hard, because you are putting it inside that block, ice block. It will not dissolve. So when you are eating uh, saturated fat, it will not digest in your body. It will just be going straight. It's the same blood that goes into our heart, that will go into the brain, go into the liver, go into the kidney, up to your toes. So as your fat is there, the body cannot use it because it's not the type of fat that it can use. It will be going up and down inside your body. When it gets to the heart will attract the heart. Some deposits will be there, some will go into your brain. That's the way fat deposit will just be everywhere, and it can shut down someone's system. And the type of fat, which are mainly organic, like the nuts, the seeds, not the vegetable. The vegetable oil that they are saying, if you go and read about it, there is no single strand of vegetable inside your vegetable. All of this from head to toe is raw materials plus more raw material that makes up our vegetable. So how somebody now be telling me that vegetable oil, and some people, Nigeria now, I made them see me where we used to do, and some people will just buy and they want you to see, and they are doing shakara. Wow. You are talking about sunflower oil, all those ones, like the coconut oil, the olive oil, the original one, all those ones. They will not clog your heart. And when it clogs the heart, let's say this is the artery of the heart that carries blood, and the fat is now staying inside, small time. When blood wants to pass self, there won't be ways for it. So your fat has to be checked. Don't fry meat and you have fried you have bleached your, okay, when you bleach your vegetable oil or even your palm oil, let's say it has a chain. There's something in chemistry we call chain. Let's say CHO, that's one chain. And I'll bleach it for 10 minutes. I've increased the chain to 2. I bleach it for another 10 minutes. I'm increasing it to 3 chain. Before you know, plus chain can be up to, by the time I bleach and the whole area or the whole house is knowing that, somebody is bleaching something there. Then I'll now bleach the vegetable oil finish or the palm oil. I bleach I fry the meat, fry the pepper, fry the chicken, fry the salt, fry the albosa, I fried everything. So all those ones is satisfactory to the mouth, is satisfying you psychologically, you think you are enjoying, but actually you have eaten nonsense plus rubbish because your heart will cry ekparekpa. And of course your sugar too has to be reduced, especially if you're 30 years and above. Before age of 30, especially 25, between 0 and 25 years of age, there's something we call metabolism. The rate our body digests and processes things is very fast because we are growing. But by the time you are 30 years of age, if you need 3,500 kilocalories of food as a young adult, by the time you are 30, you might not need more than 2,500 because you are not growing again. So when you are not saying, ebusi, ebusi, make it plenty, somebody is cleaning either the heart or the liver or the brain or the kidney. So we should just know what we eat, your fast, then you have to drink plenty of water. Our body is about 75% of water. Our skin needs water. Our mouth needs water. Our bones, the blood in our bones, the bone marrow where our body is being produced needs water. Our brain needs water. Our mouth needs water. The eyes, the ear, every part of our body needs water. That's why somebody can survive without food for days, but without water, so the kidney can shut down, the heart can shut down, the whole system can shut down. So don't just, it's not only when you are eating. They say, give me one bottle of water now, I want to eat. After that one in the morning, maybe until afternoon when you feel thirsty or you want to eat, or in the night, just one cup. Some of us, but if it's mineral, sugary drink, or some of us sabi, we over sabi sef. Some dey use even their teeth to even open a bottle of mineral and finish it at a go. Buy one pure water or one bottle water, you no go finish, and na so you go dey carry am as if you are doing exhibition. You no go drink am finish for hours. So tey the thing go hot sef, it was cold before. And of course we talked about your salt. Your salt is raw sodium. On no account must you want to eat and you are adding salt. Let's say this is my food and I say, oh, it's not too sweet, help me to add salt, and I'm sprinkling uh, raw salt. That's raw sodium in the heart. It kills. And of course, avoid people with dramas, situation and circumstances that can, make you see yourself on a level of low self-esteem. Avoid people and drama. Toxic people, toxic environment, toxic work environment, toxic relationship. Toxic relationship might not only be your partner, it might be your family, it might be your friends, it might be your colleague at work. So just know that it is very, very important for you to avoid toxicity around the narcissists. People that there's nothing you do for them, they can never stay satisfied. They are neither here nor there. They just want everything to be done for them, no reciprocation of love. Then, of course, avoid late night eating. You understand? If you're above 35 and you're going to 40 or you're over 40 and above, the maximum you could do to eat is 8 o'clock in the night. When you eat your carbohydrate, will digest between 6 to 8 hours. When you eat protein, the digestive processes might not be completed until 12 hours, especially if the protein is not like the moi moi. There's something we call moi moi. Now that moi moi is like pudding. It has been grinded into soft. So when it gets to the stomach, it doesn't have much work. But when it is raw, the beans that you have eaten that has not been grinded, when it gets there, it might stay for the next 5 hours, digesting 6 hours. And when the digestive processes is completed in the stomach, it moves into the small intestine. The small intestine begins to do it like that, moving it round, 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 as if you're squeezing your washed clothes, and it will do and make it like fine, like a camel, smooth. When it gets smooth, it pushes, so the body pushes it to the liver, which is like the mama, and the processes of distribution to certain places, the kidney will take, the liver will see save some with itself, save some here, we call them fat depot here and all that, before kidney will now take it. So it means if you eat your beans by 8 or 9 o'clock, throughout the night, when you were actually sleeping, your body and your brain that is supposed to rest and your body at rest, they were not sleeping, because it's the brain that will tell the spinal cord, oh yeah, and some hormones in the body, oh yeah, release this hormone. This guy is just eating amala. This guy has just eaten beans. So they begin to release several hormones to complete the process of digestion. The hydrochloric acid will be released there. The intestinal fluid will be released in your intestine. The liver will carry its own, it has bile that will help it if it is fatty food that you've eaten. It has pancreas that will help it if it is like carbohydrate food you've eaten. So it means to have the night, they are just sending themselves, network of connection, connecting and networking. Release this is not enough. Put more. Oh yeah, oh yeah, now the food is leaving the stomach now. That's the way they would do. The body was not actually resting when you say you are resting in the night. So that's the reason you, as a man, you're 13 and above, you need plenty of water. And if it is that you should eat, it should not be every meal at night, just small. There's something for diabetic patients. Those days they used to tell them they shouldn't eat rice, they should not eat carbohydrate. But well, there's no how your body can survive without no carbohydrates if you are used to that and you are a diabetic patient, right? So what we teach them, counsel them, and counseling session is controlling your portion. If you were eating a bowl of pounded yam or semo like this, prior to the time that you have diabetes, what do you want to do now? You can just go like this, like that. That's the way you do. Or you can make it like that. And so when you make it like that, it becomes easy for you. So there is nothing preventing you from eating carbohydrates. Let me change the NEPA strike. There's nothing preventing us from eating carbohydrates as a diabetic or hypertensive patient. The only thing is that you should control your portion, take your drug, and see your doctor. And apart from that, on the final note, you have to treat underlying medical condition. For a diabetic patient, if doctor gives you drugs January 1st, and it says this drug is going to take you for a month, instead of you to go back at the end of that month, you just decide to carry bags and you go to the clinic. You just go to the pharmacy, especially in this part of the world, that most of our drugs, you can get it at any time, anywhere. It's not enough for you not going to the doctor and just go and pick another 1 or 2 months of medication and you start using. There should be review. Like people that are living with HIV now in Nigeria. If you are living with HIV/AIDS in Nigeria, HIV in Nigeria, what they do now is you go January 1st, they do the test, and they see that we call it genetic testing. Now, if you have done HIV test outside and they say it's positive, it's not enough for us to say it's positive because it's a kit. But now they are going that place. They test the medical lab. They test your gene, and HIV attacks the gene, the DNA of our body. That's where it attacks. It will now convert itself to the DNA in my body. For example, let's say I have. Now, when it converts, by the time my body recognizes that there is A foreign body in this place. It has already replaced itself and clone itself to resemble my own DNA. So it might not be easy for me to now say, I don't want to again because we don't take where this guy don't enter body, don't take. So they now want to know because the kit that we use outside, like ELISA and all that, is just to test my blood if I'm HIV positive. Now, if they now say, oh, they will call it confirmation test. So when you get to the medical lab, we call it NIMA, they go there, test you. If those people now say it is there, it is there. So when they want to give them drug, for example, let's say January they come in and they want to give them drug, that January 1st, they are going to just they don't do to carry that HIV drugs home if they give you 3 months. And at the end of January, you are not being tested, you are not being reviewed to know if you are going to your viral load has decreased or increased. So we don't want to give you drugs without not reviewing you. So they will just give you a month dosage and said, okay, this drug is for 30 days. By 31st of January, you are coming back, or 1st of February. And when you come, they want to know, is the viral load decreased? If it has decreased, why not? They have to reduce that drugs because they have their own unwanted side effects in the body. And we know somebody that has HIV, they have to use this drug for the rest of their lifetimes. It's not drug that you will use and say, oh, I've been taking it for 5 years. In fact, I'm done. I'm tired. I said you want to your HIV to now advance to AIDS. So they have to use this drug for a prolonged period of time. So it's not something that you'll be using 500 milligram this year, this month. Next month, you are using 1 gram and you are now increasing. It can finish all the body system. So they need reappraisal, reassessment, reevaluation to be able to know, are we increasing? The viral load going down? Is the viral load going up? Is your immune level good? You understand? Is the blood level okay? Before they can give you. So if you are on any medication like diabetes, like hypertension, heart disease, immediately doctor gives you 2 weeks medication. It finishes, go back to him and go and see him for follow up. They might be able to say, okay, oh, it is okay. No, let's drop it. Like diabetes drug, diabetes drugs, there are some that are 1 gram, there are some that are 500 milligram. Doctor can place on 1 gram based on your blood sugar as at the time you come to the hospital. By the time he checks you next 2 weeks that you are coming, he might decide, oh, thank God, this blood sugar has reduced. Let me just give you 500 milligram. And you, because you are not going to the hospital, you are still on 1 gram. And that is what can lead to hypoglycemia. That is low blood sugar. And you see them fainting. Some are not come around. You just have hypoglycemia because there is excess, there is reduction in their blood sugar that cannot supply their brain and their heart, especially the brain, and they go into shock. Some might not survive it. Some might not survive it. And if you're on 500 milligram of, let's say, metformin, and you're supposed to have gone for checkup, and you're not going for checkup, and you keep on 500, and the sugar is now skyrocketing, 300, 400, it can lead to diabetic hyperglycemia this time around, excess blood sugar. And somebody can come down with diabetic ketoacidosis, and they might not come around. That is death. So it is very important we see our doctor. We have to quit smoking. Smoking is one of the things that can kill your heart. It can kill your sexual life. It can kill your kidney. It can kill your brain. It can kill your skin, kill your liver. It can kill your bones, kill your muscles. A typical cigar, if you hold just one cigarette or e-cigarette, even vaping, all those things they mix inside vaping, has over 200 ingredients, ranging from tar, nicotine, different kinds of things that they mix. So all those things in the body, no wonder that the World Health Organization and even the Ministry of Health say smokers are liable to die young. So it's not good for the body. Even if you are not a smoker, you are living in an environment like this place that is cloudy, they make a bonfire, burn all manners of things, or you are working in a place or your shop is in a place, there is fumes coming from somebody else's shop, and you're just inhaling it. Over time, it's going to settle inside your lungs where the oxygen is, and it will cover as if they paint your lungs. The lungs that is supposed to have fresh blood, this will cover it. Will now, this blackish substance will now cover the lungs, and the oxygen enters, cannot work. That's carbon dioxide. There will be acidosis, excess acid in the blood. And what will happen? That's untimely death. So health is wealth. So we've been able to talk about various things to prioritize when it comes to men's health. Things you need to do when it comes to health. So tomorrow we shall be taking on another topic. You understand? We're taking on another topic if God permits. So thank you for joining. God bless you for joining my life. Thank you. Bye bye. Have a wonderful weekend and God bless you. Love you all.